We've all been there, that uncomfortable feeling in our tummies, followed by an urgent dash to the loo. Diarrhea, as unpleasant as it is incredibly common. It's actually one of the main reasons people see their doctor. But what exactly is going on in our bodies when we have diarrhea, and why is it so important to understand? Let's delve into the world of digestion and find out. Diarrhea is more than just a temporary inconvenience. It's our body's way of telling us something isn't quite right. By understanding what causes diarrhea, how to recognize different types, and the importance of proper treatment, we can all take charge of our gut health and feel our best. Imagine your gut as a long, winding tube. Food travels through this tube, and along the way, our bodies absorb nutrients and water. Our stools, the end product of this journey, are usually solid because of this water absorption. Diarrhea happens when this process gets disrupted. Instead of absorbing water, our intestines become irritated and inflamed, leading to loose, watery stools. This disruption can happen for various reasons, from infections to food sensitivities. When our gut lining is irritated, it can't absorb water efficiently, and everything moves through much faster than usual. This results in the frequent, urgent trips to the toilet that characterize diarrhea. Diarrhea can be broadly classified into two main types, acute and chronic. Acute diarrhea is the most common type. It comes on suddenly and typically lasts for a short period, usually a few days. Think of the dreaded stomach bug that can sweep through families and workplaces. This type of diarrhea is often caused by viruses or bacteria, and usually clears up on its own with some rest and fluids. Chronic diarrhea, on the other hand, is a bit more complex. This type persists for an extended period, often for several weeks or even longer. It can be a sign of an underlying medical condition like irritable bowel syndrome, Crohn's disease, or celiac disease. Chronic diarrhea requires a doctor's attention to diagnose the underlying cause and determine the most effective treatment plan. From tiny invaders like bacteria and viruses to more chronic conditions, the causes of diarrhea are as diverse as our gut bacteria. Acute diarrhea is frequently caused by infections we pick up from contaminated food or water. Sometimes, even a change in our usual diet or stress can trigger a bout of diarrhea. Chronic diarrhea often points to a more persistent issue. Food intolerances, such as lactose intolerance, can cause diarrhea as our bodies struggle to digest certain components of food. In other cases, inflammatory bowel diseases like Crohn's disease and ulcerative colitis lead to chronic inflammation in the gut, resulting in persistent diarrhea. Diagnosing the cause of diarrhea involves a bit of detective work. Doctors start by asking about your symptoms, medical history, and recent travels. A stool sample might be needed to check for infections or other abnormalities. In some cases, blood tests or imaging scans can provide more detailed information about your gut health. The good news is that most cases of acute diarrhea resolve independently with some simple self-care measures. The top priority is staying hydrated. Diarrhea can lead to dehydration, so it's crucial to drink plenty of fluids, like water, clear broth, or oral rehydration solutions. These solutions contain the right balance of electrolytes, which are essential minerals lost through diarrhea. Over-the-counter medications can help reduce diarrhea symptoms, but it's best to consult with a pharmacist or doctor before taking them, especially for children, or if you have other medical conditions. If your diarrhea is severe, lasts longer than a few days, or is accompanied by other symptoms like fever or bloody stools, it's essential to seek medical attention promptly.